My name's Kate Strawson. I am an obstetrician, gynaecologist and fertility specialist at QFG. I started my journey at the University of Queensland, studying medicine, and started my training in Queensland before moving to follow my husband, who is medical, in Sydney. Completed most of my training in Sydney and have recently been working at the Mater in the public capacity before moving on to do private practice only. Initially doing obstetrics and gynaecology only, and then noticing that there was a gap in my practice with regards to fertility, and just being able to provide that whole care for a woman and their family in terms of fertility support if they need it, obstetric care, and then obviously gynaecology before and after if needed. I really love obstetrics and gynaecology. I think you get to be a really important part, although a small part, but a really important part in people's lives. You can really advocate for women's health, quality of life improvements, particularly when you're talking gynaecology. And I think fertility, it's a difficult journey. It's a hard time for a lot of people and their families. It's a difficult journey, and I think being able to be there for them, to support them, if we're having positive pregnancies, caring for them in that pregnancy is really sort of what drives me. And I think looking at 12-year-old girls, 13-year-old girls and going, I can make a difference in your life. I'm a chatty person. I think I'm quite a warm, fuzzy, cuddly personality. I know that that's not necessarily what everybody wants, but I really like to form a bond and relationship with my patients and their families. I think in fertility space, I've had a lot of interest in endometriosis, and so particularly care for women who have or suspected to have endometriosis in terms of providing fertility care, but also supporting them with their diagnosis of endometriosis and ongoing management with that regard. Really interested in the donor programs and supporting single parent, same-sex couples in terms of that pregnancy journey as well. I think the most important things to me when meeting someone is obviously developing a relationship with them. I think understanding what is important for them, because to an extent medicine does have a formula, or there are guidelines on what we should be doing, but I think it's what that person wants, what's important to them, and how we can achieve that. That allows them to feel that they are listened to, they are empowered, they are making those decisions with me rather than I'm making those decisions for them. My job brings me a lot of satisfaction. It is quite long hours and time away from family, so I really enjoy spending my spare time with my children who are 10 and under, spending time with my husband. I'm an Uber driver most weekends, driving my children to various things, but just watching them do sports, see their friends, doing things that they really enjoy. I think my advice would be firstly to the person, the family, is be kind to yourself. This is a journey. There will be really high days and there will be low days. Reach out if you need support. Hopefully this is not a long journey for you, but there is an amazing team of people that are here to help you on that journey.